Good evening. Thanks for sticking with us. I'm Joshua Robinson, and Kootenai Health is still seeing high numbers of COVID-19 patients, although hospitalizations have dipped since the hospital's peak. Healthcare workers have now had to treat more than 100 COVID-19 patients for more than a month. As our Ian Smay reports tonight, this has had negative impacts on both the level of care the hospital can provide and the workers providing that care.
Today, Kootenai Health is treating 122 COVID-19 patients, 41 of which are in the ICU and at least 12 are on ventilators. This may be down from the hospital's peak of 150 COVID-19 patients, but it is still spreading resources thin, and it is taking a toll on frontline healthcare workers. Even with the number of COVID-19 patients at Kootenai Health taking a dip, the situation is still dire.
I think it's good that we have less COVID patients in the hospital at this point, but I still want to make everyone aware that that's still kind of a ridiculous number of patients that we have in the hospital that are COVID positive.
Scoggins also said the hospital still isn't doing elective surgeries and is still operating under crisis standards of care. The high number of patients has caused the hospital to basically run 4 ICUs, 1 non-COVID ICU, a non-COVID overflow ICU, and 2 units dedicated to COVID patients. But the impacts on care aren't limited to just Kootenai Health. Scoggins also said that it has led to delays in Kootenai Health accepting patients from more rural clinics and critical access hospitals. He added that we may never know the full extent of the impact on these rural care centers caused by COVID-19.
I really don't know in the end if we'll ever know how many people in this area have died because of inability to get care, especially in some of these critical access hospitals when you delay care significantly to get those patients transferred. They're already quite a ways away from a major medical center.
The impact isn't just limited to the levels of care provided, it's also affecting those providing the care.
We're very much focusing on the morale of our healthcare workers. We know that the COVID-19 pandemic has stretched our healthcare workers beyond any way we ever imagined.
Leaders say this isn't just caused by the worry of being infected or spreading it to their families, but also from the trauma of what they've seen when treating patients. Cobble and Scoggins said the hospital is trying to provide resources to their healthcare workers to boost spirits. Those include things such as extra meals, providing gifts and awards to staff, and giving out thank you letters the hospital has received from the community. Scoggins also said the dip or plateau that we're seeing is likely due to the fact that we're moving past events such as the North Idaho Fair and the start of the school year. He did say that he is worried about the upcoming holidays. And for some context, the average stay for an ICU COVID patient is about 10 days here at Kootenai Health, while patients that need acute care due to COVID-19 usually stay for 5 to 7 days. Reporting in Coeur d'Alene, Ian Smay, KREM 2 News.